Thank you, Senator Lundberg. So we're asking the Attorney General to file a suit. Here in the Colorado Legislature, we're asking the Democrats to join us in an effort to preserve our rights under the Constitution of the United States as a state. And we're also pleased to join President of the Independence Institute, John Caldera, and John will come up and explain to you an effort that he has that we're fully supportive of. John?
Thank you. I'm John Caldera, President of the Independence Institute, and I want to say appreciation to all these people standing up and saying that this is, I believe, one of the darkest days in American history. This is something that I never thought I would see. Let me pull away from policy just for a second and get very personal. I have a 5-year-old son who suffers from Down syndrome. This man, this hero of mine, has endured 9 surgeries so far in his life. He is a remarkable young man. His first surgery was at 3 weeks old in order to fix a hole in his heart. If my little man, lived in almost any other country in the world, he would be dead right now. This is not some arcane bit of policy. This is not something about budget numbers here. This is not something about what's good, what's bad for pundits. This is about saving my son's life. And I will be damned if I let the atrocity that happened in D.C. yesterday threaten my son's life. Towards that end, several months ago, the Independence Institute authored a constitutional amendment as a citizens' initiative. Last week it passed through the title-setting board here in Colorado. It adds a simple right to Colorado's rather extensive Bill of Rights in our Article 2 of our state constitution. Basically says that all persons have a right to health care choice. That government, either here in Colorado or at the assistance of the United States, cannot be forced to join a health care plan they don't wish to join. Furthermore, it protects direct payment for health care services if both parties wish to do so. Our federal delegation has failed us here in Colorado. If the 5 congressmen who voted for this attack on Colorado's health voted the other way, we would not be talking here today, and this bill would not be going forward, my initiative would not be going forward. But unfortunately, they did. Starting now, it is time for Colorado citizens to take arms in the form of pens, to sign petitions to get this on the ballot, to protect Colorado, to take an affirmative action that while D.C. wants to encroach upon our state's rights, and more importantly, our own bodies, our own health care choices, the answer is no. We will not allow it. We will go on the offensive now, and hell hath no fury than Coloradans scorned by D.C.
That's right.
This will go forward. We will get it on Colorado's ballot. I ask everyone here to make a commitment to me on getting signatures. As you know, getting signatures now is much more difficult than it was in the past. We will be relying on signature gatherers, largely volunteers, and as many paid as we can afford. We need to take this stance. Colorado's health remains here in Colorado. Quite simply, it is my goal to make Colorado a sanctuary state for quality health care. Thank you.
Good, very good. Thank you, John.
And we'll now hear for a wrap-up from our Minority Leader in the House, Representative May, and Assistant Minority Leader in the Senate, Greg Rowe.
Well, thank you, John. I'll be honored to sign that petition and help you gather signatures to make sure that the best healthcare system in the world is defended against a power grab like we have not seen from the federal level, probably in the history of this country, at least from our federal government. And the one other thing that really needs to be said is that this is also the Congressional Budget Office score of this bill. Not only will it cost Colorado a lot of money, it's going to ultimately end up costing the taxpayers of the United States an awful lot of money, because the Congressional Budget score includes tax increases that go into place right away with a promise of future benefits, and more importantly, a promise of future cuts that will likely never materialize. Back in the 1960s, when Medicare was first passed, they estimated the cost of Medicare in 1990 to be somewhere around $10 billion. The actual cost ran to nearly $100 billion, 10 times what they thought it was going to cost. If anybody out there thinks that this bill and this effort to fundamentally and radically change the way we deliver health care in the United States is going to be any different, you are fooling yourselves.
Thanks. I want to take a little different tack as we wrap up here. Obviously, we'll be fighting this measure on several fronts through the ballot box, through here at the legislature. But I want you all to think about something that is at the base of this bill that the implications of it are so far-reaching as to be frightening. Traditionally, we've gotten used to the federal government giving us tax credits and tax deductions and so forth if we dance to their tune, begging us, if you'll do this, we'll give you this. State highway money. If you do this, we'll give you highway money. This is a whole new course of action. They're saying, you will do this, or we'll tax you and fine you. You will do this. It's a major invasion of personal privacy. And the assault on individual rights in this legislation is unprecedented. Where if this is okay, if it's okay to mandate that you have health insurance or they can tax you or fine you, call it what you will, what's to stop them from any other behavior in America? And I understand where they go, where they beg you, where they give you a credit and they try to entice you. We've moved beyond enticement to holding a hammer over an individual's head and say, you will do this or your federal government will come down on you like you have never seen. And where does that end? How far does that go? And that, we have obviously our policy differences, we have our difference over the economics of this, but that fundamental assault on individual rights is just reprehensible. And for that reason alone, regardless of the rest of the policy, we ought to be overturning this. And hopefully our Attorney General will join in a lawsuit to overturn that and defend the rights of the individual citizens of this Colorado. That should be our job as leaders in this state, is to defend the rights of our citizens against major encroachment of the federal government. I think we have time for questions. Yes, sir.
Have you guys heard whether or not the Attorney General is going to jump in on this? He's got a presser at 3 o'clock, and it just sounds like it's vaguely addressing this, but has he indicated?
I have not spoke to the Attorney General. Obviously, we've got a letter coming out, and I think word is around that we're asking him to have not talked to the Attorney General.
Senator Cotton, has he said anything?